Well, and about 1 in 8 women in the United States is going to get a breast cancer diagnosis. And the good news is most women can survive it if it is found and treated early. October is Breast Cancer Awareness Month. Dr. Michelle Manning, OBGYN at Ascension Providence, joins us this morning. Share what you know about breast cancer. And of course, it's a great month in that it does bring awareness, and more women do go and get that mammogram because they're reminded.
Right, absolutely. I want to take the opportunity on this show just to encourage women to get that screening done. We have 2 fabulous breast screening centers in Waco, one at Ascension Providence, one at Hillcrest. I guess it's Baylor, Scott and White. Anyway, we all have this great technology now. We've got a 3D mammogram for women who repeatedly get callbacks. A lot of women say, I don't want all that radiation. I keep getting called back.
And that's scary.
Right, and it is. It's very scary to get that call.
It's very scary.
So now we have 3D mammography where we can minimize our radiation but get way better pictures. So that's going to help a lot. We have MRIs here in Waco now. Providence has started using theirs, and it's almost full within the first year with scheduled patients. That allows us to check those high-risk women more often. So you're going to start seeing on your mammogram report a score, a percentage. Your lifetime risk of breast cancer is fill in the blank. Those women with a less than 20 just need their annual screening. But the questions that you fill out on your intake paperwork when you get your mammogram are used by, it's called a Tyrer-Cusack score, and it calculates what your lifetime risk is. Like you said, the average woman has a 1 in 8 chance of breast cancer. It's about 12%. If you hit 20%, you probably need to be a little bit more cautious, look a little more closely. So we can do a mammogram, and then 6 months later an MRI, and then 6 months later a mammogram, and then an MRI. That way you're not getting all that radiation, but we're watching closer, looking for that early diagnosis that we can treat and increase those survival rates.
Also, genetics testing for those who
Yes.
have it in the family.
Right. So again, those questionnaires that you fill out when you get there are going to calculate that score. And if you are one of those women who's over 20% risk in your lifetime, they're going to refer you to a geneticist, and you're going to sit down and you're going to look at a family history. And if you need to be one of those women who gets that genetic testing, they now are testing 23 different genes, not just BRCA1 and BRCA2, which has historically been what we knew. Now there's a whole panel that we look at. So it's amazing the research that's going on and the treatment options, screening options that we have, but then also treatment options. So yeah, get out there, get your mammogram. The screening centers are fabulous. The one at Providence is like a spa. You go in, you get a cushy robe, they give you a little cucumber water. They gave me a tour and I said, but do you still squish them at the end? And they're like, we do, but it's better now. It's not as hard. I said, okay. So they really try and make it an experience that's not so painful.
Right, exactly. And new treatments, as you say, there are plenty of new treatments that are less invasive. But if it's recommended to have the double mastectomy, there's a reconstruction.
There is, and that is not as common as it was initially.
Really?
Yeah, the research is showing that a lot of times you get chemo before your surgery, and so it really shrinks those masses down. You're able to do a much smaller surgery, much less healing, and now they've got oral chemo for some of these women. I mean, it's just a constantly evolving world. Just the sooner we catch it, the better we do.
How can they get in touch with you?
So I'm at Ascension Providence Women's Center at Highway 6, but any family practice doctor, any OB-GYN can order your mammogram, and once you're in the system, you'll get a yearly reminder card, and you can just schedule it. We want it to be as easy as possible.
Do it today.
That's right.
Thank you so much, Dr. Manning.